So what is peripheral arterial disease, or P.A.D. as it is commonly known, and how is it treated? One of Halifax Regional's top cardiologists breaks it down for us.
Arterial disease is a disease being recognized frequently nowadays. It's basically patients who complain of pain in their legs, especially when they walk, and this pain is coming from an artery which is blocked, which is supplying blood to their legs.
Any particular part of the leg that would normally be painful?
Well, usually they complain of pain in the calf muscles when they walk, but it can be pain in their buttocks and their thighs. And many times the disease is clinically silent. They do not complain of anything, but it's up to their primary care physician to inquire about these symptoms and diagnose it in their office.
Now, is P.A.D. something that we can do to avoid it? I mean, can it be avoided altogether?
The biggest risk factors for P.A.D. are diabetes and cigarette smoking. So the first and foremost thing that the patient needs to do is stop smoking, because treatment of P.A.D. is virtually impossible if he continues to smoke. We can fix the blockages with a balloon or a stent, but if he continues to smoke, the artery is going to get blocked again. And then we do need to control their diabetes, their high blood pressure, high cholesterol, make them get on lifestyle changes to lose weight, and get other things in order that way.
Now, I know what a balloon does. I hear about that quite often. What is a stent exactly?
Well, a stent is basically a metal scaffold which is usually mounted on a balloon, or it's like a slinky which slips over the finger. So this metal scaffold basically keeps the artery open. So after we've ballooned the artery open, just to keep the artery open and give it more support, because the artery is very elastic, we have to put this metal scaffold in to keep it open. And that's really a peripheral stent.
And so how does someone know whether they need a stent or a balloon?
Well, initial treatment for P.A.D. is lifestyle changes, smoking cessation, medications, and exercise rehab. People, if they continue to have symptoms after we've done all this, then it's time to bring them to the lab, take pictures, find the blocked artery, and try and open it up with balloon angioplasty or place a stent to make them feel better.
Okay, so for example then, if whether they've had a stent or a balloon done, procedure done, can they get back to normal? What happens after the fact?
Well, recovery is usually very fast. This is a minimally invasive procedure. The patient can be out of the hospital the same day or the following day. And once they're out, we do send them to rehab, because they need to get back to their usual routine. They need to start exercising more. And they'll find dramatic improvements in their symptoms. Their pain will be virtually gone the day following the procedure. They'll notice it.
So I would have to say, what would be the lesson here to avoid any of these procedures?
Well, people have to, make sure that they get their diabetes, their high blood pressure, their high cholesterol under control, medications, lifestyle changes, and smoking really is the biggest change. They have to quit smoking, and that's something we keep telling them again and again, every office visit, and we have to help them as physicians to quit smoking.
What a great group of doctors. I really enjoyed working with them, and they will definitely take care of you if you need it. The Halifax Reginal Hospital's Center for Cardiovascular Services is located on Wilbourn Avenue in South Boston. The number is 517-3250, and you can go to hrhs.org. We'll be right back.